Good morning. I'm Dr. Mariam Bakhtiari here from Manhattan Beach, California, my practice, to talk about facial exercises that perfect your face to your best natural self. A little bit about myself. I'm a dentist for over close to 30 years of practice in the field of TMJ, jaw issues, craniofacial pain, orthodontics, and sleep apnea. In here, we treat patients a little bit differently. For example, if you have a patient that comes in with malocclusion or like their bite is off, a child or an adult, instead of just putting braces or Invisalign, first we look at this location to make sure that their blood supply nerve and artery to the brain it's in the right area, and we're getting the circulation to the blood, to the upper extremity, to the brain and facial structure. So that's the first thing we look at. Is the bite off or is the bite right on before we start their treatment? And when we treat patients with TMJ, it's the same exact situation. So in here, we look at patients holistically. Treatment of sleep apnea is with oral devices that move the jaw forward. And again, same thing, moving the jaw forward. The tongue is attached to your lower jaw, opening the airway. Moving the jaw forward with appliances to open up the circulation for patients with migraine and so forth. So it's very different type of a dental practice. I don't see patients for general dentistry. I have diplomat status for both, for all orthodontics, TMJ, and sleep apnea. So my practice is devoted to this field. This picture that I just showed you is every room in my practice has one of these on each screen, because it's probably the most important thing in my life to teach others that you don't want to pinch that circulation, because that affects your whole body. A few years ago, because one part of my practice is orthodontics and beautifying your smile and creating a symmetry in your facial structure, I realized that the facial muscles, some of us are one-side clenchers or tend to be right-sided or left-sided, and we don't have, people or not really have symmetrical faces. And because we're mostly eating our food in a go fast move in this westernized world, and we're juicing a lot and we're eating a lot of shake instead of sitting and having wholesome food, I feel like our facial muscles are deteriorating. When we don't use something, you lose it. So you see 16-year-old that I'm doing orthodontics, that they have flat faces, their lips are downward mode. And I knew that since I am in the space of the facial muscles and head, who is better than me to create something, an appliance that anchors around the lips to get these muscles worked out, balanced out. At the same time, how can I tweak it so that it helps patients with TMJ issues, muscle issues, so that it become like a physical therapy for their home? And that's when the production of BLAFit appliance came into birth. And I work with an aircraft engineer, my husband who's a physician, and we designed the BLAFit appliance to not only work out your facial muscle, lift the cheekbones, plump the lip, lift the side of your lips, at the same time tightening your jowls and creating a nice jawline, but also the measurements that are taking place. This is where I want you to be able to open that big on a natural, healthy jaw movement. So it's basically rehabilitating your bite and jaw for those of us that have locked jaw and problems, if it's done correctly. So in order for me to be able to bring something that's a semi-medical device to the market, I need to be able to be behind it with my staff to train them how to use it. So originally we had the instructions booklet inside the boxes, and now on top of that we have a QRL code that shows me going step by step teaching you how to use it. But also we offer a 5-minute one-to-one consultation with you, where I look at what you need. If you want your jaw lines to be tightened, do you have jaw issues or not? so I could teach you how to do it correctly in order not to create more trauma. I remember that one of our reviewers in our review on Amazon said that it created jaw issue, and unfortunately I can't go back. I don't know who these people are. They're not giving me their feedback, but I feel like if they take advantage of their 5-minute one-to-one, I will teach them as a TMJ specialist how to do it correctly, not to impinge anything in this location. And if they have a disc or clicking jaw, when they open and close, if the jaw clicks, I can teach them how to use it so that they improve that. So I feel that I wish one day she comes to our videos and sees and takes advantage of her 5-minute one-to-one, because we're offering that now, but we're getting pretty booked with, I do that in my lunch hour. My staff does that in their time. I have somebody called named Natalie that she does that. But I feel like if we have hundreds of orders, we wouldn't be able to give that much time. Sometimes we go over 15 minutes with clients. I see everybody as my potential patients that I can help, whether they're here in Canada, in Australia, anywhere in the world. I want to be able to reach out and teach you that these exercises actually can help improve your TMJ symptoms and improve your beautiful face symmetry. So that's where we have the offering. One of the major things that I want people to know that when we do the vertical exercise, which is in our Amazon site, I have the video. It's basically having the appliance. I'll do that for you too. Inside your lips, and while you're moving the upper and lower lips together, just the lips, you're shifting the lower jaw forward. We're adding the breath, which makes the blood circulation improve, and we're creating a meditative exercise that will put our whole central nervous system, which is our brain, into a parasympathetic nervous system mode, which is a mode that you heal, you digest, and it's great. So I'm going to do that right now. I have my sister and brother calling me from Germany, and I have to keep pushing them up. So here it is. Notice it's only on the lips. We're not using our hard tissue, our teeth in anything. So there's no way you can have trauma to the tooth structure or anything else. All the other products on the market, it really gives me goosebumps when I see that these manufacturers are selling so many to poor people out there that they don't know anything about TMJ. These big things they put in their mouth and they're clenching, it actually enlarges the clenching muscle and makes you more square. And by doing that, you're also pushing this jaw back and creating more impingement and TMJ. And I'm very saddened by that, because people don't have education, and anything that's out there that affects your facial muscle can impact your brain. So we need to be very careful how to use these appliances that enhance our beauty to be able to not create more trauma. For example, the gua sha. If we're doing the gua sha that's out there, I would love to add, never ever push it backward. If you push the gua sha backward, we're creating again stress and moving the tissue and the jaw backward toward all the circulation into the brain. So when we're doing things, we need to be trained to do it always outward, always outward. We never want to impinge this area. This area is your roadmap to your brain. That's where your nerve, artery, vessels go to your brain. So we never want to clench, and we never want to push things back. Everything has to be outward. So when we're teaching the belly lip appliance, we want to make sure that when you do it, this is how you do it. So our jaw is supposed to open about 50 millimeters maximum opening. And when you push the jaw forward, you're actually opening up the circulation to the brain and creating a much calmer body. So you're not only working out your lips, tightening your jowls, working all these muscles, but you're also creating a healing brain, a calm brain, a rest and digest brain, where you can actually look at the colors beautifully. You could be enjoying your day. So imagine doing that in your daily busy schedule, and you're just stressed and you just do one or two of this workout, and you can just go back to your desk and you'll be more productive. So I feel like if I'm not here right now telling you, I feel like people don't take advantage of what this could do for you. There's so many benefits to using it correctly that it almost makes me responsible to be here on a weekly time to talk about it and see if anybody has questions and teach you guys that mouth and jaw and facial structure are very important in our well-being. And if we are in tuned by Botox injections, or fillers, will fill the structure of our face temporarily, but what it does, it works out the skin outer layer. And when you fill the outer layer with liquid, you're actually ballooning your skin and stretching your skin, and that's something that I wouldn't want to do to myself, because then when your body absorbed the liquid that's given, then now you have extra skin that you have to add next time, a lot more, to be able to fulfill that same result. And for me, tightening the skin has to be from inner layer, from inner muscular area. If we tighten it and push things out, we're tightening, we're increasing circulation with that pumping effect. And the resistant arms holds the weight lifting that you need for your facial muscles. They're very small muscles, and we don't need a lot of pumping effect to get that beautiful face, that increased circulation, collagen formation. And we don't need to put all these serums that is only on the outer layer. We're working from inside out, creating an opening for the blood supply and creating an environment for our body to be healed, more beautiful, and zen. I don't see any questions. I see 4 people joining us. If you have any questions, ask. Otherwise, my beautiful husband just walked in and we're going to our farm. Today is my day off, and we are going to see how our farm trees are. And I don't see any questions. I'll be here next week at our normal 10 o'clock time. Please remember that if you have a Bella Lip appliance, bring it next time we have Amazon Live. Let's talk about it. Let's work on teaching you how to do these exercises correctly so that you can benefit not only from beauty, but also from the meditation, increase circulation, help your headaches, help your jaw issues. This product would not create jaw issues if it's done correctly. So have a great day. Have a blessed day and enjoy. It's in California, it's cooling down a little bit. So I hope that you stay cool, safe, and I'll see you next week. Have a great day. Bye-bye. I'm done, honey. Let's go.